ahead and get started. Thank you, Josie. Welcome, everyone. We always appreciate having you on this quarterly provider call. As a reminder, I'm Amanda Slater, the Assistant Deputy Director for the Department of Health and Human Services, and we appreciate you all joining us today. For those of you that are new to this quarterly provider meeting, just wanted to give a brief update that we will have division representatives giving some updates and then being available to answer questions. We do have representatives available for multiple OUs today, so even if they don't have an update, but you have a question specifically for them, feel free. We have the Continuous Quality Improvement Division, the Division of Child and Family Services, Division of Licensing and Background Checks, Division for Services with People with Disabilities, Juvenile Justice and Youth Services, our Medicaid Long-Term Services and Support Office, our Office of Coordinated Care and Regional Support, Substance Use and Mental Health, and Procurement and Contract Management. And if I forgot anyone, I am so sorry. I tried to get all those names out there. Just a quick virtual meeting housekeeping reminder. We do have closed captions available for those who would like them. If you just click on the live transcript in the menu bar at the bottom of your Zoom, you'll be able to enable those closed captions. Additionally, we do record this meeting. It'll be posted on our website. So if you have individuals that were unable to attend, they can always reference it there. Also, during the meeting, you can drop questions into the Q&A feature at the bottom of there, and we will do our best to answer all of those today. We'll have some time at the end of the meeting to cover those. Additionally, we do appreciate those of you who submitted the questions prior to this meeting. That does allow us time to gather that information and get back to you. And we will drop the chat where you can submit those at any time so that we can respond. And the first thing that we have today, I'm excited. We do have our Executive Director, Tracy Gruber, here today. And so I'm going to turn it over to her to give you guys a brief update.
Thanks, Amanda. And I'm trying to fix my video because my face is taking up the whole screen. But thanks, everyone, for joining us today and on the quarterly basis. We know that you all have a lot of work to do, and taking time out of your schedule to meet with us is just added on top, and we're just appreciative. I'm Tracy Gruber. I'm the Executive Director at the Department of Health and Human Services. And I've been on these meetings before, but we kind of were looking to see when the last meeting I was on, and it had been quite a bit of time. And that's just not okay from my perspective, given the important role that you all play with serving the people of the state in partnership with our department. And so I personally will be making sure that it is a bit more frequent than I am joining this call to hear what's on all of your minds and the various concerns, opportunities, I hope, positive things that are happening. But I just want to start out by thanking you all very, very much. I've said this before, and it bears repeating, that the Department of Health and Human Services and that the work that we do throughout the department is in partnership with all of you. We do provide direct service, but we only provide a fraction of the direct services that are being carried out throughout the state, and it is through all of you, our provider community, that is doing that work. And we are deeply, deeply committed to ensuring that our partnership with you is as effective as it possibly can be, while recognizing that we all have responsibilities and obligations and rules and laws that we all comply with, and no shortage of those for the department or for any of you. And so I do just want to thank you, but also acknowledge that over the past several years, we've really dug deep in some of our divisions to look at our relationship with our providers and the regulations and the administrative rules that you all have to comply with. We have to administer them, and we have to make sure that they are being complied with. But you have the hard job of implementing the rules that we have. And I think my screen froze. Did I freeze for a second? No?
You
Okay.
you
I
might have froze, but we can still hear you, Tracy.
Okay, thank you. And so I just want to just mention to all of you that we are, I mean, Division of Licensing and Background Checks. I think many of you know about that project and have been participating in that and providing feedback on our administrative rules in that area. That team has been working really hard for the past 4 years to try and get our rules cleaned up, get new ones written, and that's on top of implementing new laws that get passed every single year. And I think we're all acutely aware that session is starting in a week and probably more rules to implement, Shannon. Sorry, but it's just the world that we live in. And so we're very deeply committed, and all of our operational units have been asked to look at their administrative rules, not just Division of Licensing and Background Checks. It's a goal of the department. It started last year for everyone to review their rules and make adjustments, get rid of ones that we don't need anymore, make sure that the ones that we do have are can be comprehended, that they're understandable, and that you all, as our provider partners, have an opportunity to provide feedback on those rules. You all should know that process, but if you don't, we can make sure that you get that information to know when new rules are posted, how you can provide feedback to us, which we do look at, not only because we're required to look at it, but also it's the right thing to do to make sure that we're putting in place administrative rules that you can follow and that will also serve the Utahns that we're all serving together as effectively as possible. Our department is deeply committed to our vision that all Utahns have fair and equitable opportunities to live safe and healthy lives, and we carry out that vision in everything that we do. And it is really very bright and shining in our results-based accountability report that's published on our website, which we look at every single year and invite you to look at and provide feedback to us on. And we can make sure the link to that plan is included in this chat so you can take a look at it. We're on a cadence of reviewing that plan every spring, so around May-ish, April, May-ish, and would love to have your thoughts so that we collectively can make sure that we're realizing that vision that all Utahns are healthy and safe. One thing that I just want to provide an announcement on that some of you may be aware of is that on December 29th, I think was the date, we were notified. You may know that there was a large amount of money that the federal government through the Department of Health and Human Services released for rural health. It was in HR 1, which was the bill that was passed by Congress, also known as the One Big Beautiful Bill, that was passed in Congress in early July. And we applied for funds for the Rural Health Transformation Program and received for year one $195.7 million. It's a 5-year grant. We're hopeful that every year we'll receive that amount or close to it. And it's really designed to ensure healthy rural communities, rural health systems that are strong and sustainable and ensure that there's health access for people who live in rural communities and really make generational investments in health systems in our rural communities. So we're very excited about that. What is funded in that rural health grant was in our grant application, which is also available online, and we can make sure that you have that link as well. And it explains what the department, in collaboration with all of the rural health stakeholders who are engaged in helping develop that plan, will be investing in over the next 5 years. What's important for all of you to know is that the bulk of the funds that are going to be distributed to our rural health communities are going to be administered through requests for grant applications. So we will have RFPs, RFGs that will be released probably in the next 6 months, if not sooner. And entities will be able to apply for that funding in accordance with that grant application. So if you're not registered to get grant notices from our department, you might want to consider doing that if you feel that you are an entity that is involved in the rural health system in a rural county. That is something just for you to keep in mind. You also probably are aware, definitely since the last time you met, since this is a quarterly meeting, I know you haven't met for quite some time, but the governor did release his budget in early December. There was coverage of that, but I just wanted to highlight a few things that are in our agencies, in our department's budget, in his budget book, his budget plan, and also caveat that with everyone, I think, understands that that's just his proposal, but that the Utah legislature, quote unquote, holds the purse strings and they decide how money gets appropriated to our department and all of the state agencies. And so while the governor has issued his plan and how he would propose the money should be spent, the legislature over the next 45 days, once they come into session, will appropriate funds. So we're hopeful and we will be on the Hill supporting the components that were in the governor's budget and hope that the legislature agrees with his plan as it relates to the Department of Health and Human Services and approves those funding requests. And I'll just highlight a few of those and then turn the time back over to Amanda. There is a $1 million one-time request for adoptions of Utah's hardest to place children. And I know Tanya Myrup, our director of DCFS, is on the call and can answer any questions related to that. We have a one-time $1.5 million for the Baby Watch program. We have a funding request for our new Operation and Correctional Health Services that we've been administering care, providing health care to individuals who are incarcerated through our correctional health services. We have a $2.8 million request in juvenile justice and youth services to handle some programmatic issues and recidivism of that juvenile population. We have a one ongoing request of $12.5 million for mandated additional needs in youth aging out of DCFS and JJYS who have disabilities. And that funding is to cover the costs in addition to those youth, people who have new needs who are on the HCBS waivers. And then we also have almost $1 million for the Medicaid aging waiver that was included in the governor's budget, and also a one-time request for securing meals for Utah's aging population for $1.7 million. So again, these are the requests that some of the requests that were in the governor's budget. I think we have a total of 12, I want to say, Amanda, and I just named 7 of those 12. If you are interested in knowing more about what's in the governor's budget, maybe you overlap with other state agencies, not just ours, you can find out more information in the governor's budget book, which was released again, I believe it was December 12th. So we're looking forward to partnering with all of you, seeing you up on the Hill or otherwise. And again, just really greatly appreciate our partnership with you. And I don't know what our timing is, Amanda, as to whether or not we have time for questions. But again, grateful for your partnership. Together, we're going to ensure that all Utahns are healthy and safe and move the needle for some of our populations that are struggling to achieve the opportunities and the hopes and dreams that they have for themselves and their families. Thank you.
Perfect. Thank you, Tracy. Yeah, as far as questions and answers, we have a little bit of time here in just a minute for that. But if people have them, if they want to start dropping them in the Q&A portion, we'll definitely get to those. So while we're doing that, I will thank you again. I appreciate you coming and chatting, Tracy. It's fun to see you, even if it's not always as often. We are going to go ahead and shift to some of our operational unit updates. So I'm going to first start with the Division of Licensing and Background Checks. So Shannon, I believe I'm turning it to you, if not, one of your office directors.
That is great. I think our updates are for Office of Background Processing. I'll just run through them quickly, and Daphne, feel free to add some additional context to that. So actually, I am very first going to turn it over to you because you have an employment or employee update.
Correct. Yes, I would just like to let everyone know on this call that since we last met, we have a new lead analyst over this team. Her name is Chantel Stanworth, and she is going to be primarily focusing on DSPD and contracted providers for human services. And so she is excited to get started. And with this, we wanted to introduce her today, as well as the best ways to contact her, and just information is still through our general inboxes, which are the DHHS contracted at utah.gov, as well as the CBS unit at utah.gov. But she is going to be receiving those emails specifically related to contracted services.
Thanks, Daphne. And then just really quickly, we have, again, for OBP, a training for virtual training. As you might remember, we've had some in-person trainings for the process, for the DAX process, the background check process for human service providers. And we had committed to offering a virtual session as well. So that is coming up, just to save the date, for February 19th at 10 a.m. You should be getting emails about this. If not already, then tomorrow morning, I think. Look at that. I can read lips too as my job skill. Tomorrow morning, you should all be getting emails with this information, as well as a link to the Zoom link to join that. So that's all of our updates.
Thank you, Shannon. I appreciate that. Looks like the next update we have is for the Division of Child and Family Services. So I believe, Tanya, I'm turning it over to you.
Hi, good afternoon. Just a real quick update that the license sites that are required to serve behavioral youth from DCFS and JJYS procurement 91266. If you will please reach out to either Kyla Clark or Talia Quartuccio if you need any help with anything. And that's it for our updates.
Great. Thank you, Tanya. Well, appreciate those updates. And it looks like we do have some time now for our questions and answers. I'll just kind of, as you guys have been submitting questions, go ahead, drop those in the chat. Again, you can submit them during this meeting, prior to the meeting, after the meeting. We'll try to get back to you as soon as possible. We will do our best to answer all the questions today. However, if we're not able to get to all of them, we will follow up separately. One thing that I will request is that sometimes individuals have questions specific to a client situation. We won't be able to address those specifically, but if you want to give us your email address and what division it is, we can contact you directly. Just I know sometimes those things come up on this meeting, and we want to make sure that we're answering questions that apply to everyone. So we'll go ahead and we'll adjust to that. Tracy, of course, you mentioned the rural health grant. So we got a question about what do I need to do to receive the grants for, or the emails about the grants that will be coming out on that.
Well, typically there's a website that releases all the RFGs, and we can follow up and make sure that we give you the right one. I actually don't know what it is off the top of my head, but I know that there is one, and we'll make sure that you get that. You also can send an email to the rural health email address, and I think I'll look on my email contacts and make sure, and I'll drop it in the chat. If you want information on those grants, it would be best to, oh, somebody dropped it in. So thank you, maybe Josie. If somebody can, if you're interested in those grants, you might want to email that email address and let them know that you're interested to get notified when those grant applications are released. That's probably the second best way to find out. But I think if you apply for grants, just generally knowing that website address is probably a good thing to have on hand anyway.
Perfect. And I don't know it on hand either. So Josie, maybe if you write a note when we send the follow-up email, we can include that link in it for the general grants. Okay, we'll transition to some other questions. I think I'm going to come to Carrie. There is a question about when is the next meeting? I missed it. Will it be posted somewhere? Not quite sure if it's this meeting. I know we have other meetings as well, but they mentioned a CQI, so I don't know if it's one of the other meetings you host. So I'll turn it over to you.
Thanks, Amanda. And just for everybody, Carrie Bambro, Director of the Division of Continuous Quality and Improvement. Yeah, so I know DHHS does host a various meetings to support our provider community. We do try to send emails out when those meetings are up and coming so that you'll have that information as well as the link that you'll need to join. And if there's any ways that you can submit questions ahead of time, we'll also try to include that in the link. But since this was addressed to CQI, I did want to just say, so the Office of Service Review does host a quarterly technical assistance call that's specifically geared towards new contracted providers. We did hold one in December. Our next one will be Tuesday, March 3rd at 1 p.m. And we will be sending out an email reminder with the link to get on that, as well as a way that you can submit questions that you want to make sure we address at that particular meeting. We do try to have some targeted training, so if there's anything out there that you all would like some additional information on, we can have that prepared, but we will also just have time for question and answer so we can help answer questions that you may have for any of the new providers out there. And while we do target it towards new providers, any of you are welcome to attend. So we'll get that information out. And like I said, we'll try to get any meeting that we've got going on across the department, we do try to send out by email so you all have that information. Thanks, Amanda.
Yeah, thank you, Carrie. And I'm going to go ahead and take the next question, and then I'm going to actually tell Tracy she's welcome to jump in with me because we don't have our population health folks on here. But there's a really great question, I actually think, that says measles can spread quickly in our congregate care shelters. And is there any recommendations to help staff in shelters with outbreaks? Absolutely. We have an entire website about measles that can show kind of where we're seeing outbreaks, has guidance linked to your local health departments. Love that you're asking this question and that you care. We do know broadly that vaccines the best protection against measles. So that's definitely important. I don't know, Tracy, if you want to add anything else, but thank you for asking.
You got it covered.
Okay. Yeah,
Nailed it.
absolutely. And I'm gonna take a little audible project because I'm here. Also, we are seeing the flu spread, so we definitely want to make sure that you all take the precautions for the flu as well, as that's something. So on those same websites, we have information on that as well. I don't know if there's I appreciate that you all care very much about our individuals in our congregate care setting, and we can definitely get you in contact with the right individuals if you have additional questions or concerns. All right, Tanya Myrup, I'm going to kick the next question over to you. The question says, why is DCFS so focused on the biological parents? In all of the cases that I have been a part of, DCFS has continued to put the children in physical and emotional danger in order to protect parental rights. The children are often treated as property rather than people.
Hey, thanks, Amanda, and good afternoon, everyone. As Amanda said, I'm Tanya Myra, Director for the Division of Child and Family Services. And I really first just want to acknowledge the seriousness of the concern that's being raised here, and that feeling that children may be in some instances placed at risk. So I appreciate the opportunity to respond to this and want to express my gratitude to the individual who submitted this question. So I think this really gives me that opportunity to help us clarify our philosophy and kind of the why behind that philosophy and the decisions that we're making and really as well as just helping us better understand and assess the functioning of the child welfare system and identifying those potential gaps in how the policies and how they're being implemented and experienced on the ground. So just to talk a little bit about the reason for the emphasis on the family of origin. So that strong emphasis is really based in both a fundamental legal and ethical principles. It's not intended or meant to be a disregard for the child's well-being. The framework is intended to support the child's best interest, and again, not disregarding that. So in child welfare, you may know that the core principle is really that children hold a fundamental right to be nurtured and raised in their family of origin, and that's whenever safely possible and appropriate. And so just to reiterate that, that really is our paramount concern, and that is the non-negotiable commitment that that primary goal of DCFS really is that all of the action that we take should be supporting the safety and well-being of the child. And with that said, parents do have a legal right to receive reunification services, and there are just a few pretty narrowly defined legal exceptions to that. So these principles, that emphasis and focus on child safety being paramount, along with recognizing the child has a right to be raised in their family of origin, and along with also pointing out that parent has that real constitutional fundamental right to that, to be able to parent their child as well. So trying to balance all of those things and achieving those stable, permanent, safe outcomes through reunification is really ideal, again, when it's safe and achievable. So when we are running into maybe a decision that you, as we're pursuing reunification, and you're feeling like it's really creating an unacceptable risk to the child's physical or emotional safety, it really signals that area for immediate review and attention within our system. So if you are personally involved or become aware of a specific case where you feel like those decisions seems to create a risk for the child, we are strongly encouraging each of you to really utilize those communication pathways. And that would include if there's an immediate risk or concern about abuse or neglect, reporting that to intake, speaking with the caseworker. If you feel like that's not being heard, you can take that through the supervisor or the administrative or regional team, as well as lifting that to the child and family team, those meetings as needed. So I'm, of course, extremely concerned anytime there's the sentiment that children may be viewed as property rather than as individuals with their own rights and needs. So I am incredibly interested in just learning and understanding more about this perspective and hearing from those who may have those observations that may feel that decisions being made are counter to those priorities. So again, as a provider, stakeholder, you are also welcome to contact me directly to discuss those concerns. It is, as you may know, it's a vast and complex system, and we really rely on your honest and constructive input in order to ensure that we have accountability to that and that we can continuously enhance and improve our system. So I don't want to take up too much time with this, but I wanted to spend a little bit of time just kind of grounding everyone in that philosophy and that approach and what you can and should expect, as well as if you do have concerns, the right forum to lift those concerns so that we really can ensure that that priority and that focus remains on the safety of children. So again, and then I guess as Tracy had mentioned, she doesn't have always the availability to attend this meeting, and I have also not been able to attend a lot. So while I have the virtual microphone, I guess as they say, I just want to take a moment to also extend my gratitude and appreciation to each of you and the important role that you play in supporting the safety of children and strengthening families. And it truly is an important partnership, and we're part of that whole system working together. So again, if you Please contact intake or lift any concerns about child safety through the appropriate channels, but please also feel free to reach out to me anytime. I would love to have more discussion about this and make sure that the system's really working effectively.
Okay, thank you, Tanya. And I think, some of these topics, it warrants taking a little bit more time to talk through because they are so nuanced. And it's always good to know that I think at the heart of this, all of us have the client's best interest at mind. And I always appreciate that with our provider community. So thank you for that. Okay, we are going to shift to the next question. Chanel, I have this question for you. It says, I run a recovery sober living home. Are there funding or resources available to help residents who are coming or with housing when they're coming out of rehab or reentry, detox, jails, hospitals, etc.?
Great question. And I have responded to this or will respond to this at two different levels. So the first one is directly related to the individual and their specific funding. So a lot of that could be based off of like if they have insurance or insurance coverage, if they're eligible or have Medicaid, if they're unfunded or looking at services that are underfunded. There is some funding available around that. A lot of that goes directly to the local authorities within the individuals and catchment area. So what county they reside in. Each county, the local authority, receives funding from the state and also from the Fed, so some federal and state funding that allows to cover some of these services. A lot of the clinical services that substance use and mental health, or some of the services that are non-clinical, like the sober supportive housing, or some of those other things that are not really based off of clinical that could be supported. So again, this is done through the local authority, so they would have to be receiving services or funding from the local authority in order to get some of those services. But there is an opportunity, and I did want to talk a little bit more at the agency level, which is my second response to this, is if you are a sober supportive home and you yourself as an agency is seeking funding for that, there are possibly funding opportunities that are posted on the state of Utah purchasing website that could be a solicitation for providers to provide those direct services to individuals. We've had some of those in the past, and anything that we put out would be on the state of Utah's purchasing website as a solicitation or funding opportunity. So you could look for those if you're an agency that's seeking funding. And one of the other options is to work within the local authorities and see if they are subcontracting with agencies to provide those services to individuals that they are providing services to or services they may be looking for. So you might want to look at who the local authority is within your county region and see if they've got contracts that they're looking to fill for sober supportive housing or any other collaborative efforts that could be done to support these individuals. And I do appreciate the question. Housing is a very tough thing to deal with within the state of Utah. We understand that. I do really appreciate the questions and looking to support these individuals as they look at reentry from incarcerated settings or coming out of other types of treatment, and they're looking for housing or other things that can support their recovery.
Okay. Thank you, Chanel, and I appreciate you kind of doing that comprehensive from the individual and from the provider. I think that's helpful.
You're welcome. Thanks.
All right, we'll move to our next question. And I think, Travis, you're on deck for the Division of Licensing and Background Checks. Can you review or clarify what the required staff and patient ratios are for day, swing, and grave shifts at an intermediate secure youth facility?
Excellent. Thank you, Amanda. My name is Travis Broderick. I'm the Assistant Office Director for Licensing. So the staff to client ratios are 1 to 5. So 1 staff to every 5 clients in intermediate secure care centers. And that's for day shifts and swing shifts. And then nighttime shift would be a 1 to 16. We go back to the residential treatment rule. And again, there isn't a specific rule for immediate secure care. So that's when we go back to the RTC rule to find those specifics as to those ratios. We also require, in addition to those ratios, we want to ensure that adequate staffing is met to ensure and supervise clients at all times, the current population, depending on, if there's certain behaviors or dynamics of an individual or the client treatment needs, you're required to provide staffing according to client needs. And so that may be in addition to the 1 to 5, maybe it's a 1 to 2, again, just depending on the needs of the current program. So great question. Thank you for seeking clarification.
Great. Thank you, track of this. Appreciate you tackling that question. Next question, I think I'm going to turn to you, Angie, for Division of Services with People with Disabilities. The individual asked that they said under a new contract, they cannot bill host home if an individual does not sleep in their bed at night. There's some additional details here. I'm trying to summarize that. But there's some concern about having to take a client back and forth between their home, and if there's some inability to bill if an individual is not in their bed at night, how can a provider navigate that when an individual may need to go back and forth? Hopefully I got that. I tried to summarize a bunch of details there. So
Thanks, Amanda. So first, I just want to put out, we agree that people should be paid for the services they're providing. And that's one of the reasons we ask for mandated additional needs every year, so that as people's needs changed, we can make sure we're able to compensate for that, the services provided. Alongside this, we need to assure that we're accountable for the funding we receive and assure that that there's not a misuse of Medicaid funds. Part of what needs to be assessed is if the right service code is being used. So if the person isn't staying overnight, should it be a supported living service or something else? We've had multiple scenarios where people have been sleeping at the host home less than they're sleeping away from that, and that is a daily rate. So what we're recommending is that providers and support coordinators are working together to look at what the right service scenario is for each person that they're supporting, and what that mix of services looks like. We've got a breadth of services to be able to find the right services for each person. And if you're running into concerns or barriers, please reach out to our constituent services team, and we can work together to navigate this and make sure that we have the right services in place and that we have the right supports for the staff providing the service as well. So thank you for the question.
thank you, Angie. Appreciate you taking that. All right. Next, I am going to switch. And Daphne, there's a couple about the Office of Background Processing. So I'm going to kind of just maybe have you handle those few right in a row. The first one is, are we permitted to submit fingerprint-based background checks in the childcare licensing portal and in the DAX system for the same employee?
Thank you. So yes, the Office of Background Processing uses different systems to complete our background checks, depending on the purpose of the background check. And so because of this, someone or like an applicant may have occasionally the need to be fingerprinted and have their information entered into more than one of our systems that we use. There's just different sets of rules and requirements. For the background checks, primarily there's a different set of rules and a different statute for childcare than there is for human services. And so if that individual is associated with your program and with a childcare or vice versa, then they would need to be entered both into each system.
Thank you, Daphne. I appreciate that. And the next question is, I have an employee who waited till the 11th hour to get their fingerprints done, but they did get them done. However, I'm assuming it's meaning DAX. In DAX, it shows closed, fingerprints not taken. Who do I contact or how do I address this?
Great question. The best way to get this resolved is to reach out to the CBS unit at utah.gov, and we can look at these cases on an individual basis and provide the best direction at that time. Also, if you are seeing in DAX that it's getting close to that fingerprint deadline, and again, the best place to figure out where that fingerprint deadline is on the DAX homepage under at a glance and use the eligibility determination in process queue. You can see there, and it gives the fingerprint deadline in that queue. If it's getting close and your employee has not been fingerprinted yet, and you're trying to urge them to get it, or they've got an appointment scheduled, but it's after that date, if you can reach out to the CBS unit at utah.gov, we can then extend that deadline that would prevent these from inadvertently being closed before the individual is fingerprinted.
Perfect. Thank you, Daphne. I think that's important to know. If you've got an employee delayed, reach out early, then you can get that extended. So perfect. All right. Sorry, just looking here through the questions. Angie, it looks like I have another one from your group, and I am just going to apologize to everyone on the call because it's using acronyms and I don't even know what they mean. So maybe in the answer, Angie can help clarify that. It says, with the new contract, you can't bill for MTP and DSI. This affects clients who are in the rural area and can't get transportation. Is this something that can be looked at?
It's definitely something that can be looked at, so we can look into that. Thanks.
Perfect, thank you. And I would just add on that, I can tell poor Angie's losing her voice there, so I'll ping in for her. If you have a question about a specific client's need, I think definitely reach out to your support coordinator or DSPD, and we can always assess that person's situation to see what we can do to make sure they can get their services. All right, next question. I don't know if Tracy was talking about this. Joseph might be the right person. I don't know. So I'm going to throw it out there and I'll let you two tag in who wants to handle it. What was the request for additional funding for the AGES services, specifically the aging waiver?
I think I put that in the chat in response to the question, but I will repeat it. So for the Medicaid aging waiver mandated services for at-home care, it was almost $1 million. It was $953,200. And then there was a one-time request that will go to the area agencies on aging. I said that right. Yeah. Talking too fast, for $1.7 million for Meals on Wheels.
Perfect. Thank you. All right. It looks like we've got a couple that are here for regarding childcare. Shannon, and these are a little hard, so you might not be able to answer them, but I will kick them to you and you can respond what you know, or otherwise we can get back. One says, I have a daycare and this is my first time. I have questions on taxes. Do you have any response to that?
Great. Thank you, Amanda. And sorry, I did not formally introduce myself when I first talked. Shannon Toman Black, Director for the Division of Licensing and Background Checks. So for tax questions, unfortunately, because there is so many nuances with taxes, we cannot give specific advice on that other than we would advise that you speak with your accountant about that.
Perfect. Thank you, Shannon. And then the other one is a little bit broad and also brings in the governor's office. So Tracy may want to weigh in too. It says, has there been any changes for childcare subsidies with the governor's childcare reforms? Do we need to warn parents that they could lose their DWS payments?
I would recommend that they contact the Office of Child Care and the Department of Workforce Services. I don't know that we're aware of those changes, and the subsidy program is administered by them.
Perfect. Thank you, Tracy. I appreciate that. All right, it looks like we might be hitting the end of our questions. So if you have any last minute ones, go ahead and drop them in. Looking just in our sheet to see if we had any other last minute, but I'll kind of give a last call reminder if there are any other last questions. I saw one just fly in here, and we might have to follow up. It says for the budget for healthcare in correctional health facilities. Does this specifically address hospice or palliative care, or is this a budget item since prisoners aren't covered by Medicaid or Medicare? Um,
You want me to take that one? Can
Go
you just
for it,
repeat
Tracy. I was going to try to wing it, but I'll let you take it.
Can you just repeat it just so I'm clear on the question?
Yeah, so I think the question is about healthcare in correctional facilities and
Yes.
whether it addresses hospice or palliative care, or is this to address prisoners that aren't covered by Medicare or Medicaid, is how I'm reading it.
Okay, I don't know if it's specific to the budget request that I mentioned, but generally, the Correctional Health Services provides all um, healthcare related needs to individuals who are incarcerated in either in the state's prison, two state prisons, and then the jails throughout the state. And so, hospice and palliative care, I know, are areas of care that are provided because we have a very um, there are a lot of aging inmates who are needing that kind of care as part of their health care. And so, yes, that is provided. Medicaid is not allowable for people who are incarcerated within the prison walls. Once they leave the walls of the prison, they can get Medicaid, but so this is not a replacement for, this is just the healthcare system, the healthcare delivery system that's provided to individuals who are incarcerated.
Perfect. Thank you, Tracy. And as always, when I do a last call, a whole bunch of questions come in again. So thank you guys for getting in there. And we have about 10 more minutes or so, so we'll try to get to these. It looks like there are a couple more for Office of Background Processing, Daphne. So the first one is for DAX. If you receive a denial on an application, what is the time frame for an applicant to appeal after receiving the notice?
Thank you. The applicant has 15 days from the email or the date on the letter to respond. And within this, that can be even including and reaching out to us to say, hey, I need an extension. And we can work with that applicant on an individual letter level on what time frame will be best for them to respond.
Perfect. Thank you, Daphne. And then another one for you is, will there ever be a way for us as an employer to see why a person is denied in a background check, or will the information only go to the person in question? I often get asked by people who are rejected why that happened, or if I can help them appeal the decision.
Because of the privacy and kind of dissemination laws in this state, until those are changed, we cannot disseminate what is on a person's background. We have kind of updated our processes, and so we're trying to be more clear in the letters to the applicants of stating the things that we are looking at for the reason that they might be denied, so that that can kind of help put them in the right direction of saying, oh, I've essentially, I'm going to say broad terms, it's have they ever been arrested? Have they ever appeared in front of a judge? And to help us understand those circumstances is really what we're looking for. Has they ever been investigated by Adult Protective Services or Child Protective Services for abuse or neglect? And so those are kind of the broad things to help. And then if they can think through those instances and respond to our office.
Great. Thank you, Daphne. I think we've got a couple for DSPD. So I don't know, Angie or Dean or Marcy. It looks like we got all three of you on here who wants to take these. So the first one, it says, when you say you'll look at MTP and DSI, what is the timeline for looking at?
I can jump in, and I know I don't sound great. I apologize for that. And Shannon, I also failed. Angie Pina, Director of the Division of Services for People with Disabilities. Grateful to be here with you all today. It'll take a couple of weeks. It really isn't going to take a long time. Part of what I need to do is make sure we're coordinating with our Medicaid team, making sure that we're looking at what the rate actually includes as part of its package, to make sure to assure we're not doing any double billing. that we're aligned with how the service descriptions are structured, that we're aligned with expectations from Medicaid. So I just need a little bit of time to like follow up and double check on some of that stuff.
Perfect. Thank you, Angie. And if that individual wants to send their email, I'm sure we can circle back with them once you've been able to follow up. That might be the best way.
Absolutely.
Perfect. And then another question for you all is, does a change from again, sorry, y'all use acronyms. Does a change from a DSG budget to a DSP budget require an RFS with the committee review or RFS committee review? Somebody guess what I just said, because I'm trying to figure that out myself.
So those are 2-day service service description codes. So it's hard to answer a question like this with such limited information because it really depends on if the change involves a change in the number of units and supports, because that would need to go. So so it really is going to depend on what you're changing and what that need is. So I would say currently the best route is to go through the RFS committee. That's our request for additional services committee. We are currently working on that budget neutral path. Um, and we've gotten feedback from support coordinators on that, and that's something that we're actively working on, which will be released in the future that will positively affect something like this.
Perfect. Thank you, Angie. Looks like maybe one more. I'm making an assumption based on what they're asking for that it's DSPD. So it says, how do we find out more about the paid caregiver compensation program?
So we do have what it actually is, it's the supported living service, and there's an allowance for we've received an allowance for Medicaid to be able to compensate parents, guardians, or spouses for the supported living service. So if you have a family member in services or a spouse, that's something that you can discuss with your support coordinator or case manager about what the right services are for that person. So is supported living delivered through caregiver compensation something that is in the best interest of that person, is going to meet their needs? There are some things that we do assess. Like one of the things we're assessing is capacity of the caregiver, and this does not question like your role as a spouse or a parent, but it's really trying to assess like what are all of the demands, and do you have that time and capacity to be able to actually provide this direct service? It does require skills development and training, community engagement. It requires documentation, doing a monthly summary. Um, but it is available, and it is something that like we really appreciate being able to broaden our choices and having this as an option for people. It also needs to be a service that the person is choosing. So among the services that make the most sense for them, it needs to be the service that they're selecting. So hopefully that gave you enough information, and if not, please feel free to reach out. We know that this is a newer service option and that it's something that people continue to navigate.
Perfect. Thank you, Angie. Appreciate that. I'm going to come to you, Joseph, in just a minute, but I'm going to take this next one myself. It says that I would like to have additional staff join these calls. How do I sign them up and include them in the distribution list? Unfortunately, our link in the email to sign those up somehow broke while we were getting the emails out this quarter. So I apologize about that. But when we send the follow-up email, we will include a link that allows you to add those people to that list. So I apologize it wasn't included, but you should be able to share that email with individuals in your organization when we send the follow-up with the video, and there will be a link there to sign up for the list. So we will get that fixed. All right, Joseph, as a newer agency, I'm not entirely sure where we receive the aging and new choices waiver referrals. Could you help with that?
Absolutely. Joseph Ambernack, the Director of Long-Term Services that supports within Medicaid. For pretty much all of the waiver programs, an individual is assigned either a case manager or support coordinator when they come onto the waiver program. They help perform level of care assessments and establish what the assessed needs of the individuals are on the program. From there, we look at what services are offered to see which the individual may qualify for, and then also work with them to look at the available providers of those services and work with the individual and family to help make those selections. So it is really the individual that works as that driver of who ends up being their selected provider, again, based on their assessed needs, and then working with their support coordinator, case manager, and others that participate in the creation of their care plan. At that point, we usually reach out to the providers, make sure they have capacity and a willingness to serve that individual given their needs, and that's where that coordination happens with the individual agencies.
Perfect. Thank you, Joseph. And I know we're just wrapping up. So I'm going to address one more question, and then it looks like there's an outpatient one. So we may need I'm not sure who can help me with that one. So while I'm answering the next one, if you all can look at that question. One of the questions was, do we need your names and email addresses for attendance? Nope, we absolutely do not. This call is for you all, but there's no attendance. This is intended to be helpful to you. One thing that I did want to mention as we're kind of getting to a wrap up here is I know there are a lot of very specific questions and we have follow up. Sometimes there's a lot of different paths to get to us, and sometimes it's hard to know exactly who to get to. So we do have an email address for our CQI inbox that's we'll drop it in the chat, but it's DHHS_CQI@utah.gov. If you're ever unsure of who to ask your question to or how to get to the right place, that is a good spot to go to. Carrie and Jessica's team are phenomenal. If they can't help you, getting you to DSPD or DCFS or whoever it is that can help you. So I just want to make sure that you guys kind of have a one stop. If you get off of this call and you realize, hey, I wanted to follow up on a specific thing, definitely that's always an email address you can go to, and we can get you connected with the right person. So with that, I know there is a question about applying for an intensive outpatient license. I don't know, Shannon, because what the follow-up question is may not be yours. It says, what is the next steps to qualify for Medicaid and insurance, and who do I contact to set up for billing? So I'm thinking you probably don't have that. Maybe Joseph.
That's who I would kick this over to.
Apologies, I am not the one to assist with this one.
Okay, I didn't think so. I'm assuming that you would, as far as to qualify for Medicaid, it would likely follow the Medicaid provider enrollment process. Joseph, shake your head if you think I'm wrong on that, but I think as a new provider, you would do the Medicaid provider enrollment process. Is typically how you would do that. As far as if you want to provide services to DHHS clients, we have those all available of what our open contracts are on our procurement website. So you can apply through there. And I apologize, we don't have all the details to answer that question. Tried to do our best to get you in the right direction there. With that, I think that is the last of our questions and that we have time for today. I really do appreciate you all joining, asking your questions. I know there's a ton of questions. We always appreciate them. Look forward to this call. Thank you again just for all of you that attend. Thank you for serving Utahns. As Tracy mentioned, we couldn't do this work without you all as our providers. Together, we all are able to meet the goal to ensure Utahns are healthy and safe, and we really do appreciate your part in that. Just thank you. This call, as a reminder, it is recorded, and we will send a follow-up email with that link so that you can pass it along to anyone that missed it that may want to do that. Our next quarterly meeting will be April 14th, same time, same place. So noon via Zoom. Look forward to seeing you then. Have a wonderful rest of your day, all.